Welcome back. In this Zoom video, we are going to be learning about white blood cells and platelets. So let's talk about white blood cells or leukocytes. If we go back to the blood draw that you had, the 1 centimeter blood tube, and from there we went to the cubic millimeter in size. In that cubic millimeter, we had about 5 million red blood cells. And in that same cubic millimeter, we'll have somewhere between 5 and 10,000 white blood cells. Okay. And when we look at those white blood cells in this picture, what you can see is they look different from each other. Some of them are weird, some are purple, some are blue, some have red stuff going on. When we look at the nuclei are different from each other. But what we can do generally is we can divide them in 2 categories by looking at their cytoplasm first. And the question is, do I see granules in the cytoplasm or not? And so we're going to take our 5 types of leukocytes and divide them into those 2 categories. As far as the life cycle of a white blood cell, it kind of depends on what type they are. Pretty much all of them only cruise around in the blood for a few hours before they will exit to go do their jobs. And how long that they stay in the tissue for possibly doing their jobs could be as few hours, less than a day, or most of them are going to be there 4 or 5 days, but some of these can be around for years. So I'm not going to ask you to learn how long each one circulates in the blood and how long they stay in the tissue. Just realize it depends on the cell type. So the first of the 2 big categories of white blood cells are called granulocytes. And so these are the cells that have granules that are visible in the cytoplasm under normal light microscopy. And what these granules are, they're vesicles filled with chemicals, mostly enzymes that are going to help fight disease. But we're going to learn some specifics about what's in these granules for at least one cell type. So here is a picture of the first cell type we're going to learn about. And if you look at this, I think the nucleus is what's most striking in that you see we've got odd-shaped little pieces of nuclei which actually are attached to each other through little strands of nuclear material. And so basically, it's not just a normal nucleus like you expect, but this nucleus has a lot of what we call lobes, a lot of little lobes, at least 3, could be 5 or 6, but at least 3 of these lobes attached to each other. Now, the normal stain looking at blood uses both a red stain and a bluish purple stain. And this one has granules, which you can kind of see in the cytoplasm, but they're not picking up the blue stain and they're not picking up the red stain. So they're neutral, like Switzerland. And so that's how this cell got its name. It's called the neutrophil. Phil means to love. And so this one is just neutral. Other names for it are polymorpho nuclear cells, which just means the cells with the different looking nucleus, abbreviated as PNNs, and usually called poly. So if you ever hear somebody talking about polys or read it in the book, they're talking about neutrophils. So in the neutrophil, we're having multi-lobe nucleus and granules that do not stain red or blue. And these are the cells that at a site of injury are your first responders. They're like the EMT. Now, that's not their job. That's just how fast they respond. What their job is to find stuff that doesn't belong there, whether it's debris from damaged cells or whether it is bacteria, and to do phagocytosis of that. And we will see an increase in neutrophils in the blood when you have bacterial infections because they tend to very aggressively fight bacterial infections. And they'll also be the first people, not the first people, the first cell type to show up when you have any type of inflammatory process, as we'll learn about when we study the lymphatic system. Now, the second type of cell, I think you can clearly see in the cytoplasm, we have all these red granules. So it's picking up the red stain. And slightly hidden here, the nucleus is not showing up purple, but it's showing up pink in this particular picture. And it's kind of hard for you to see, but the nucleus actually has two big lobes. So this is called an eosinophil because eosin is the red stain, and this cell loves the red stain. So an eosinophil has red granules in the cytoplasm, and the nucleus usually has two lobes, is bilobe. Eosinophils are one of the lesser common cell types in your blood, but you make them when you have allergies or if you have a parasite infection. And these granules actually help this cell be an anti-inflammatory cell. So when your body has antigens reacting with antibodies, these cells actually can phagocytose that antigen-antibody complex to help reduce the inflammation in an area. Now contrast that one to this one, and here you see that the granules are a dark bluish purple in color, and that is not eosin, that's the other stain. And so this is known as a basophil with all those blue granules in cytoplasm, and usually it really obscures the nucleus, makes it hard to see because the nucleus usually stains the same color as the blue granules. These, when they move into tissue, we give them a new name. It's still the same cell, it just has a new name. And in tissue, they are called mast cells. And so both basophils in the blood and mast cells in the tissue have the same granules, and they have granules that contain a chemical called histamine, which I'm sure you've all heard about with allergies and stuff, where you take antihistamines to get rid of the itchiness and the red eyes. So histamine is pro-inflammatory, causes inflammatory reactions. And then the other chemical that's found in basophils is something called heparin, which has to do with clotting or preventing clotting from happening. So those are the three granulocytes. So since there's 5 types of leukocytes and 3 are granulocytes, that leaves us 2 that don't have granules, and so they are collectively called a granulocyte because that prefix A means not or without. So here is the first one. When you look at the nucleus is often shaped kind of like a bee or a bean or a little fetus, like this one is kind of. So it kind of always has like this dimple thing going on in the middle of it, and no granules that stain. So I think you clearly can tell the difference between this one, and the only other one you would confuse it with would be the neutrophil, but the nucleus looks totally different in the neutrophil than it does in this cell. And this cell is known as the monocyte, okay? Of all the 5 types of leukocytes, it is the largest one. So if you're seeing a really big white blood cell, odds are it's going to be a monocyte. And monocytes don't do anything while they're in the blood. It's only after they leave the blood and go to the tissue at the site of inflammation or a site of infection that they become the cells known as macrophages. So your macrophages basically are the monocytes floating around in your blood. And so their job, is phagocytosis. And that leaves us the last cell. The last cell is another agranulocyte. In this one, we have a nice big round or oval nucleus, which is always going to take up someplace from about 70% of the cell, as in this one, to like 90% as in this one. So I think you clearly can see the difference in the nuclear shape of the 2 agranulocytes. This last cell is your lymphocyte. So in the lymphocytes, the nucleus is going to fill the vast majority of the cell. And lymphocytes, these are the cells you may have heard of called B cells and T cells, because those are B lymphocytes and T lymphocytes. And then there's another related cell you may or may not have heard called the natural killer cell. And so B cells have a slightly different job than T cells, but all your lymphocytes fight viral infections. And so this is really cool because when you do a blood sample and you're looking at somebody's white blood cell, you can see it has the count gone up. Do they have, instead of 5 to 10,000, do they have 15, 18, 19,000 white blood cells? That tells you there's probably some kind of infection going on. And then by comparing the percentages of lymphocytes to neutrophil can lend you to, like, if neutrophils are way up, like, then you go, oh, I think it's probably bacterial. But if lymphocytes are much higher than normal, then you go, oh, I think it's probably a viral infection. And natural killer cells we'll come back and talk about again, because they are super cool cells, and just by themselves, they can destroy cancer cells. So keep on exercising, because that increases your natural killer cells. All right. So never let monkeys eat bananas. So this is just a mnemonic to try to help you remember the names of the 5 leukocytes in order from never let monkeys eat banana: neutrophil, lymphocyte, monocyte, eosinophil, basophil. And this is in order from the most popular one, neutrophils, which normally are about 2/3 of your white blood cells, followed by lymphocytes for about another 1/3. And then the last 5 to 10% is the other 3 cell types. So if you had really bad allergies or a parasite infection, your eosinophil count, when I said it goes up in those, I don't mean it's going up to 30, 40%. I mean it goes from 2% to 3 or 4%, which is quite significant. In really bad cases, maybe 5 to 8%. Okay. And basophils, they are usually few and far between in your blood. All right, so I talked about, like, these are the cells in your blood, and then I kept on talking about them in tissue, and you were probably wondering, well, how do they get from the blood to the tissue? And that is through a process called diaphogesis. So go ahead and say that word, diaphogesis. So where this process of diaphogesis happens is in the smallest little vein thing. So blood goes from arteries, big arteries, to smaller ones, to capillaries where gas exchange happens. And then you'll, on the other side, you can have small little veins called venules, and then those will merge to form your bigger veins to take the blood back to your heart. So this happens after the capillary and the little small venule. And the reason why is because blood flow is still pretty slow. This is like the capillaries where blood flow is the slowest. Blood flow is the slowest. So blood flow is still slow here. And so once they have exited, then they can kind of move around like an amoeba, where they stick out part of the cell and kind of like drag the rest of it behind. And so here's kind of how they happen. Whoops. They're cruising along, rolling along in the bloodstream, and then they will stick, if there is like an inflammatory reaction going nearby, that can cause them to stick to proteins whose names you don't need to know on the inside of the blood vessel wall, which really kind of stops their forward flow. It's kind of like, dude, we've got a party going on here. I want to invite you to come do your job. And so then what happens is they just squeeze between the cells, forming the lining of the blood vessel walls. And that, once they're out in tissue, then they will follow the chemical signals to get to the site where they need to do their job. So they can be found in blood, but they also can be found in tissue and also in lymph, which we'll learn about later on. Now realize that some of them may have new names, such as the monocyte in blood becoming the mast cell in tissue. And which one do we just call a macrophage or a phagocyte in tissue? Don't remember, go back and look that up. Okay, so disorders of white blood cells, then hopefully if you understand that white blood cells can both be in blood and tissue, that we can have problems with white blood cells in both in blood and tissue. And so most of you have heard the term leukemia before, and leukemia basically is just the malignancy of the white blood cells, the leukocytes, white, emia, blood, when they're still in the blood. And it can be any one of these cells or any of their precursors, as we'll be learning about in a subsequent video. Now, if the malignancy is of these cells, but it's located in tissue, then we don't call it leukemia, because as I said, that emia means blood. At that point, once it's in tissue, it's going to cause like a swelling in the tissue, and then we change the name to a lymphoma. So let's move on then to platelets, which are sometimes called thrombocytes. Now, thrombocyte is not a word you're going to need to know. So basically, thrombus is a clot in a blood vessel. And so platelets are responsible for creating, for starting the clotting process in the blood, which you'll learn about when you learn the physiological processes related to platelets and plasma. So looking at this picture, is this a blood smear or is this red marrow? Stop the video and look at it for a second. Okay. So hopefully you recognize the majority of these cells have a nucleus, and that's not what we find in a blood smear. So this is red bone marrow. And in this red bone marrow picture, do you see this big, huge cell? It's pretty obvious because I have an arrow pointing to it. It's a big, huge cell that has this really huge, really funky looking nucleus, which actually is a bunch of nuclei which have fused together. So this huge cell is a cell called the megakaryocyte. So karyo means nucleus and mega means huge. So this just means the big cell with the big nucleus. Now, if you look at the perimeter of this megakaryocyte, what you will notice is there are granules there that are staining a dark purple. And you can see it on this one in the bone marrow too. Do you see them right here? Okay, and you can see this little piece coming off right there. So when this little fragment of dark staining material comes off, breaks off the megakaryocyte, that's a platelet. So platelet is not a cell, it's just a little cell fragment that contains these chemicals which stained. Okay. And a platelet, once it has broken off the megakaryocytes floating around in the circulation, it only lasts for about 7 to 10 days, and then it has to be replaced. As opposed to the 5 million erythrocytes and the 5 to 10,000 leukocytes in that cubic millimeter, you have about 250,000, probably 350 million platelets. And so platelets are very important for starting the clotting process. They do something called forming a platelet plug. Now, a platelet plug is not a blood clot. Okay? A platelet plug is what it sounds like. It's a group of platelets which have stuck together, which is the start of the process and triggers other steps. In addition, platelets secrete these chemicals which are in these granules, and these chemicals do some really fascinating things. One of the things they do is they will cause that damaged blood vessel to actually go under spasms, so it will narrow its diameter, and by narrowing its diameter, it's like the 405 losing a whole lane of traffic, which means everything going down travels at a slower speed, which is great. Okay? And it also releases chemicals which help start the clotting process going on. And so it's doing a lot of things to reduce blood loss, to induce this process of hemostasis. And in fact, if you don't have enough platelets circulating in the blood, for instance, if you had less than 50,000, then you would have spontaneous uncontrolled bleeding, because any type of touching, injury, whatever, you would just start bleeding. So that's just not a good thing. All right. So with, oh, and here is the picture of the blood smear showing the size of the platelets compared to the erythrocytes. So this, actually, I have two different pictures here showing blood clots, okay? And so in both of them, I think you clearly can see that red blood cells get caught up in the blood clots, but we have all these fibers. You see all these fibers? That's going to be part of the clotting process you'll learn when you learn physiological mechanisms. And over here, these little green structures are the same as all these little purple structures, which are all the little platelets. And then, yes, white blood cells get caught up in the blood clots as well. But remembering that we have 5 million red blood cells for 5,000 white blood cells, that's why you're pretty much only seeing red blood cells in these particular views of the clot. And with that, we are done with the Zoom, and I will see you back shortly. Thank you for all your work.